Thanks, Ruth. Thanks for the kind introduction. Hello, everyone, and welcome to the Digital Health and Communication session. As introduced, my name is Adam, and I'm thrilled to be here today with all of you as we explore the topic of maximizing patients' groups' influence through social media towards better health outcomes. Before we dive into the topic, allow me to share a little about myself. I'm currently with the National University of Singapore, working as a digital health expert, where I utilize technology to improve health outcomes for targeted operations. So, what does that mean? I'm actually what they would call a health informatician, and I have worked on digital health projects across various geographical regions, especially in the Middle East as well as Asia Pacific region. This includes Dubai, Abu Dhabi, the Kingdom of Saudi Arabia, as well as Asia regions, China and its related territories, South Korea, and of course ASEAN region where I am based as well. And throughout all these different regions, I've worked with different stakeholders. Some of these will be with the respective ministries of health. Some are with healthcare organization, providers, hospitals, research institute, and sometimes with patient organizations. So what I do is what we call digital transformation in health. And this will include helping to shape policies as well as change management with the various stakeholders. Because when you embark on a digital journey, it can be intimidating in the beginning. So you need some hand holding. And throughout all these works, two things that is really common would be helping to shape policy changes as a health informatician, as a public health professional. And we use a lot of data, so policies and data. Now, why data? Because in healthcare, we are evidence-based. You need to demonstrate evidence, and the only way to do this is data. And this is the reason why I will be talking a little bit more about data later today in today's session. But first, let me continue with my introduction. Now, with regards to APPIS, I have to say it has been extremely privileged to serve as the council member for the APPIS initiative for the second year. And during my time with the community and platform, I felt incredibly impact. I felt the incredible impact that patient influencers can have on shaping healthcare policies and improving health literacy. And that is why I'm so excited to be here today to provide my bit to help nurture the next generation of patient influencers who are at the forefront of driving health literacy and policy shaping efforts. Now, it is important to recap that it is the collective aim of APPIS to empower these individuals to create social impact through social media platforms, eventually elevating patient voices in healthcare decision makings. For those advanced patient organizations, we'll be also exploring health data informatics topics to provide even more resources and insights for driving positive change in healthcare. Now, if I can have the overview of today's segment, this was covered by Ruth earlier today, but we'll just briefly have a look at it. So you see all the speakers, and do stay tuned to my session later when I'll talk about dream bigger in the digital era. And I also like to take this opportunity to share some of the available resources and tools on the APPIS platform, where we've developed a comprehensive resource center that's designed to support patient influencers at every stage of their journey. And I'll elaborate a little bit more on these available resources at a later part of my presentation. Overall, I am incredibly excited about the work that we are doing here in APPIS, and I'm thrilled to be part of such a passionate and dedicated community. I sincerely hope that today's event will inspire you to join us in our mission to create a better, more patient-centered healthcare system. Thank you for being here, and let us get started. What I'd like to do is to introduce the next speakers, Bahija, who is a fellow council member, and Corinne. Now, Bahija is the Middle East and Africa representative of the Chronic Leukemia Advocates Network, and diagnosed with CML in 2022. Bahija is a patient advocate dedicating to improving the care conditions for cancer patients. And also, there will be Corinne, who's joining the conversation. Dr. Corinne is a pioneer in visual healthcare communication, using metaphor to make topics like cancer more approachable. I'm not going to give too much away, but I'm going to leave it to the ladies to share what they have today. Bahija and Corinne, please.